Hi, welcome to the webinar today about flock health, the importance of production records, and biosecurity. My name is Dr. Judy Hodge, and I'll be taking you through the presentation today. So first of all, take a minute to think about, what does flock health mean to you? Each flock is unique and has unique goals. So take a minute to consider what flock health means for your individual flock. Is it the presence or absence of disease? Or is it more the production records or the production methods, such as the number of lambs weaned per ewe or lamb weaning weights? Maybe it is simply keeping as many alive as possible. I love the cartoonist Henry Brewis. He brilliantly captures some of the frustrations of raising sheep. Why is it that sheep seem to have this reputation of dying for no apparent reason? In my opinion, it's at least partly because sheep diseases are often not immediately obvious. They tend to have long incubation periods, so that the animals can have disease and be spreading it, but they look normal. Many sheep diseases don't respond to antibiotics, and the disease symptoms can be very subtle or cause only small production changes that aren't immediately noticeable in an individual sheep, but over time and across the whole flock, they can have a big impact on your flock's productivity and profitability. So the iceberg metaphor is often used to describe this phenomenon, basically showing that if you have one sick animal, it's actually indicating a bigger problem. So an animal that's sick can be obviously sick with the signs like coughing or weight loss or diarrhea. And there's other animals that could be infected but not showing signs, or showing such subtle signs it's very hard to see, such as they missed a meal, or they didn't get pregnant on the first time they were bred. Maybe they weaned fewer lambs this year than they did the other years. Or maybe that's a shortened productive life for you, so that she's called out of your flock earlier than would normally happen. So sheep suffer from many diseases that don't immediately cause obvious disease. And today we're going to go through 3 diseases and talk about how the unseen impacts can have a big impact on your bottom line. Just a quick note about the format of the webinar. A lot of the slides are going to have quite a bit of writing on them and be pretty intense. And I wanted to do that because in a webinar format, some people learn better by reading, so they can follow along on the screen. And if you want to print the slides out for future reference, you'll have the information available to you. Okay, so today we're going to talk about Maedi Visna and ovine progressive pneumonia. And this disease causes decreased conception rates and lamb weaning weights. There could be an increased lambing mortality rate, and it also results in premature culling, pneumonia, hard udders, arthritis, and hind limb weakness. A second disease we'll be looking at is Johne's disease, which has been shown to decrease a sheep's overall lifespan, causes significant weight loss, and also decreases the litter size, or the number of lambs born, and the amount of the lamb's weaning weights. Scrapie is a third disease we'll look at. This disease causes weight loss, and it's a neurological disease. We'll talk about how you can use genetics to prevent Scrapie from occurring in your herd. Before we get into that, though, I want to talk just more broadly about some big changes that are on the horizon. As of December 1st, 2018, all antimicrobials will require a veterinary prescription. Prescriptions can only be provided when there's a valid veterinary client-patient relationship, and we're going to discuss what that means in the next slide. So why is this happening? This is not something that's coming from veterinarians or even from the government agriculture department. This is coming from Health Canada in response to international pressure to protect public health and preserve the effectiveness of antimicrobials. The global urgency of antimicrobial resistance and the awareness of this problem was highlighted in September 2016, when the United Nations met in New York and talked about antimicrobial resistance. The future of using antimicrobials in livestock requires improved responsibility and oversight when using them, so that we're using them appropriately. Using antimicrobials is a privilege, not a right, so we need to protect this privilege. What does increased veterinary oversight mean? It means making sure that you're using the right drug for the bug. Make sure that you're using the right dose, not too much or not too little, which can, if the dose is off, it can make the antibiotic ineffective. It also means keeping the food safe from drug residues, so making sure that you follow the appropriate withdrawal times. Reducing carcass trim loss through proper injection site and injection techniques, and also as a result of public demand for increased veterinary oversight and increased responsibility in using drugs in animals in agriculture. So there's two big questions here. First one is, what is a VCPR, a veterinary client-patient relationship? This is defined by each province. Currently in Manitoba, it's under debate, and we're discussing exactly how we want to have it worded. But the overall principles are that it involves regular annual flock visits with your vet. Your vet knows and accepts responsibility for your farm, livestock, and health issues, and you, the client, agree to accept the vet's advice. And your vet is available for follow-up. So before we move on, I'm going to show you a quick video, and just bear with me as I switch over to make sure that this works. Okay. Okay, so I'm back, and I hope you appreciated and liked that short video. That's from the province of Ontario, but it captures the main parts of a veterinary client-patient relationship and really shows how it's really more about a conversation and a relationship with your veterinarian to make sure that you're getting the best care for your animals. So the second big question is, how are we going to protect animal health and welfare without using antimicrobials? And the answer to this is that basically, we still do have antimicrobials and they're still available, but we need to use them with increased veterinary oversight. We also, though, need to make sure that using antimicrobials appropriately means that we're not using them to compensate for other problems, such as poor management or husbandry. So this means that we need to switch back to the traditional art of husbandry and stockmanship, making sure that the barn and the facilities are clean, that the ventilation is good, you're not stocked too densely, and those sorts of things. So also we need to use vaccines and other preventive care products more effectively, and it helps to understand your farm's bugs. So using diagnostics smartly in a way that helps you understand what's present on your farm and what is helpful in treating those. You need to know when to treat and how to treat, and this means having protocols in place. And this goes back to having a veterinary client-patient relationship where you and your vet have worked out what are you going to do in different situations. So we're going to get back to that kind of at the end of the presentation. For now, we'll move on and talk about these different diseases. So Maedi Visna, or ovine progressive pneumonia, or OPP, it's the same disease. So in Europe, it's called Maedi Visna. In North America, it's more often referred to as ovine progressive pneumonia, or OPP. And what is it? OPP is a lentivirus, lenti meaning long. So that means that this is a virus that has a long incubation period. It causes a persistent chronic disease. And the long incubation period really means that it takes a long time for the animal to develop clinical disease. So they can become infected at a young age and not show signs of disease until later in life. But in the meantime, they've been shedding the virus and infecting other animals. There's no cure for this disease. The words Maedi Visna come from Icelandic, Maedi meaning shortness of breath, and Visna is Icelandic for wasting. Clinical disease is not usually seen until an animal is at least 3 or 4 years old, and disease is more likely as the animal's age increases. So how does OPP spread? The main way is from dam to lamb. So the disease can spread to the fetus during pregnancy. It can also spread through colostrum and milk. And what does this mean? This means that when you are supplementing colostrum, fostering lambs, you need to be aware of where you're getting that colostrum from and what the disease status of the ewes are. You don't want to put healthy lambs onto an infected ewe and then the lambs become infected. It also is another risk is when you have lambs in the flock that are stealing from other ewes, if they're stealing from a ewe that's positive, even if their own mother's not infected, they could be getting exposed by stealing from animals that do have the disease. And this is another reason to understand your disease status and call out positive ewes as soon as possible. OPP can also spread through the flock, through nose-to-nose contact. It can become aerolized and spread through the air. So this is important in enclosed barns. And the virus can spread without animals looking sick. So if they're in an enclosed barn with poor ventilation, it's more likely to spread between animals. And of course, it can also be spread by blood contamination of equipment, things like syringes, shearers, surgical tools for castration or tail docking. It's important to keep these clean of any blood contamination. So what does OPP usually look like? There's 3 main things that OPP typically presents as. Thin ewe syndrome, where a ewe loses weight but maintains their appetite. Chronic pneumonia, so this can cause increased breathing rates. You can actually see the chest moving up and down and the abdomen as well with increased respiratory effort. They don't have a fever, which is what distinguishes it from a bacterial pneumonia. And if you cut them open, the lungs are characteristically a tan color and really heavy and firm. And this is because the lungs are filled with fluid and other inflammation cells. The other sign is hard udder. So the ewe looks normal, the milk looks normal, but the udder is uniformly hard and there's less milk available for the lambs, which ultimately results in increased lamb mortality or decreased lamb weaning weight. So remember that OPP is a virus, so antibiotics will not work. So no response to treatment is a huge red flag. If you have an animal that's thin, she's breathing hard, there's something wrong with her udder, and you want to just try an antibiotic, and there's no response, that's a huge red flag for you that you should think about OPP. Now, I want to show you a video again of you with increased respiratory rate. Just going to get this pulled up. I'm not going to show you the whole video, but the link is there so you can watch the video at your leisure. I think it's really helpful to actually look and watch these ewes so you can understand what does increased respiratory effort really look like. So here we go.
These ewes are thin and are infected with the MV virus. MV was confirmed as the cause of the breathlessness shown by the sheep in the centre of this picture. As the level of MV diagnosed on the farm from the diagnostic test and follow-up testing was high, the decision was made to call the whole flock to slaughter and replace with MV accredited stock. The clinical signs of MV are often not apparent in MV infected sheep. Half of these rams are carrying the MV virus, but are yet to show the symptoms of disease. You cannot tell which they are by just looking at them.
Okay, so I like that video to show you what respiratory effort looks like, and also, oops, sorry, and also that it can be really hard to notice. You saw those nice healthy rams. They're in good body condition and they look totally healthy. So you can't tell if you've got it or not just by looking at your animals. So the thing about sheep diseases is that the signs are really nondescript. So lots of things can cause a ewe to lose weight, and diseases like OPP can present in a lot of different ways. So in addition to the ones we just discussed, OPP can also show up as arthritis, so particularly swollen knees or hocks. When you feel these joints, there's fluid inside. So the joint itself is swollen and soft to touch, and also the ewe will show signs of lameness or pain in those joints. The other way it can present is as a neurological disease. So neurological means the brain or nervous system. This is usually if OPP presents in a younger animal, less than 2 years of age, and it tends to start showing signs in the hind limbs more than the front limbs. So you might see a weakness, dragging a limb, unable to stand up, their lips might be trembling, and these are all signs of a neurological disease. Now remember that there can be many other diseases that present with neurological or brain symptoms. So it's important to consider other things as well, but it does trigger a thought that something is wrong and needs some investigation. So if you get the virus on your farm, why don't all of the sheep immediately get OPP? So the OPP, as we've discussed, it spreads easily and can cause a wide variety of signs. But there are a lot of different strains of the virus, and clinical signs can vary with the strain. And as well, the progression, the way the disease develops or how fast the ewe develops disease, and the severity of the disease symptoms can also vary with the strain of the virus. There's also a difference in the breed susceptibility. So breeds such as Texel, Border Leicester, Finnish Landrace tend to be more susceptible, whereas Columbia, Rambouillet, and Suffolk tend to be more resistant. But remember, that's just a generality, and all sheep are susceptible. Genetic susceptibility also varies with an individual. Just like humans, some animals, some individuals are better able at suppressing disease or staying healthy than others. And nutrition and management can play a role in this. For example, a ewe that's heavily pregnant or has just finished raising a lot of lambs and lost body condition because of that, she may be less able to fend off infection than a ewe in better body condition that only had a single lamb. So, when should you suspect it? Suspect OPP if you see any sheep that's more than 2 years old with a progressive pneumonia, meaning the disease is getting worse, they're having an increased respiratory effort, you can see their abdomen and their chest moving as they struggle to get in enough air, or if you see the other signs we talked about, like neurological signs or arthritis. Okay, you can take a blood sample. The blood test is quite reliable, and you can also consider pooled samples. Pooled samples mean that you put more than one animal into the testing thing. So this allows you to test more animals, but with fewer tests, so it keeps your costs down. The disadvantage is that if you have 5 animals in a single test pool, you can't tell which of those 5 animals was positive. So work with your veterinarian on that to decide what is the right approach for you. And that'll be very individual depending on your flock status and style. So if the test is negative, great. Remember that prevention is key and continue to work towards preventing it. There is no vaccine that you can use to protect your animals. So make sure that if you're buying animals from other people, buy from a producer that has a known status, so from an MV virus negative flock, or test the incoming animals to make sure that they're negative. And if it's positive, cull the positive animal and their offspring. Remember that OPP is a virus, antibiotics are not going to work, and it's a lifelong disease that is passed on to offspring. So that's why if you've got a ewe and she's positive now at age, say, 5 or 6, and you kept one of her ewes as a replacement, and that ewe is now 2 or 3, you still need to cull that ewe because she likely was infected, but it's just not yet showing signs. So is OPP common in Manitoba? There was a 2010 study done in Manitoba looking at 2,207 sheep from 77 flocks. We found that almost 2.5% of the sheep were positive for OPP, and about a quarter of the flocks were positive. It was more common in bigger flocks with more than 70 sheep. And this makes sense because the bigger flock is bringing in more animals and has more movement. In 1988 and 89, there was a national surveillance program done. And in that study, 530 sheep were tested from 13 flocks. And, oh, sorry, there's a little typo there. But just over half of the flocks were positive. And again, around 2.5, almost 3% of the sheep were positive. So those might not seem like huge numbers, but remember that you only need 1 or 2 animals in a flock that are positive to set you up for a big disease program or a big disease problem a few years down the road. The rest of Canada, our close neighbor Saskatchewan did a study in 2017, and they found that almost half the sheep and 35% of the flocks were positive. Within the flocks, you can have either very low prevalence or very high. So that within a flock that tested positive, you could have as little as 3% of the animals positive up to almost 97% of the animals positive. Okay, and again, in that 1988-89 survey, they found that 3% of sheep were positive and about half of the flocks were positive. Across the country, the 1988-89 national survey is sort of our only data, but you can see there the amounts for Quebec and Ontario. And Finn sheep, Finn cross, Leicester, Dorset, and Dorset cross had the highest prevalence in Canada. And also remember that prevalence will increase with flock size and flock age because the disease is more common when animals are older. They've just had more opportunity to be exposed. So does OPP impact your bottom line? If you can have the disease without seeing it, how could it really have a big impact? But it does. So one of the signs, so these are a few different studies that look at some of the impacts on animals, on their production values. It can be really hard to measure these types of values. But I think overall, the studies show consistently that there are negative impacts. So the first one was a decreased conception rate. Ewes that had OPP were 1.5 times less likely to conceive than ewes free of OPP. So they might eventually conceive, but they might conceive later, and that might throw off your lambing time, for example. Or if you have a very strict time, they might not get pregnant at all. It was also found that lambs born from infected ewes weighed 3 to 6% less than lambs born from healthy ewes. That might not seem like a huge number right away, but when you consider that the first days of a lamb's life are so important and to get a good start, when a lamb is born small and weak, it has just a much harder time catching up. An increase in lamb deaths in the first 30 days of life was found in multiple studies. It's thought that the hard udders with less milk lead to poor growing lambs. And again, if you have lambs that are born light and weak, then that's another problem. There was also a decrease in lamb weaning weight, an average decrease of 0.94 kilograms per lamb from a positive ewe. And finally, early culling and increased replacement costs was found to be another impact. The financial impact of this varies with the age and the breed of your flock. You can imagine that if you have an expensive purebred animal that comes down with OPP and you have to color at age 4 instead of later, then that can cause a huge impact on your farm's profitability and on your sheep quality. Okay, so now let's move over to Johne's disease and talk about this one. Johne's is caused by a bacteria, Mycobacterium avium subspecies paratuberculosis, or MAP. Even though this is a bacteria which bacteria can be treated with antibiotics, of course, but MAP has some certain protective abilities that mean it's not treatable with an antibiotic. So this is one of those outlier diseases that even though it's a bacteria, there's still no effective treatment. This is another fatal disease that has a long incubation period of 2 to 7 years, or even longer sometimes. MAP is able to survive for a long time in the environment, up to a year. Although it can't replicate outside the host, which means once it's in the environment, it's not going to continue to replicate and get more in number, but it can still survive there and continue to infect new sheep for up to a year. MAP is usually transmitted through feces or milk, and it's usually the youngest animals that are most susceptible to getting infected. Then they have the disease for a long time, 2 to 7 years, and show signs when they're older. So disease causes severe inflammation and thickening of the small intestines. In about 20% of the cases, you'll see diarrhea at the end stages. Diarrhea in sheep is just not as common as it is with cattle. So cattle that have yonis definitely have a lot more diarrhea than what you'll see in sheep, which is part of the reason why yonis in sheep is so much harder to appreciate. The sheep will lose weight, but you don't always see the diarrhea that is so characteristic in other species. We're going to watch a little video about yonis in a bit, but I'll just go through some other signs first. Okay, so what will you see on your farm if you've got Johne's disease? Okay, clinical signs are very subtle and they mimic other diseases: weight loss, diarrhea, dullness, pale gums. The most common and consistent sign of disease in sheep is weight loss, but they maintain their appetite. Bottle jaw, which is an accumulation of fluid under the jaw, can also be seen. And here's a picture with an arrow pointing to the bottle jaw. This is because Johne's disease causes inflammation in the gut, which causes leaks in the gut that let proteins out of the body into the intestines. Water follows the protein into the gut, and then this causes diarrhea. So that's a bit of the technical explanation. Okay, it's often seen at lambing when they have the other stress of lambing and producing milk. The most common cause of bottle jaw is still the barber pole worm, but remember that if you look for worms or you've been deworming and you're pretty sure it's not worms, then you can consider maybe it's Johne's. Okay, so how do you know if your flock is infected? So there is a blood test you can do, and while it's true that a negative test result can be wrong, the test result is negative, but the animal does have Johne's disease. A positive test can be trusted, and that means that MAP is present in your flock. So I want to go over that again because the blood test for Johne's disease has a really bad reputation, and that's true because if you test an animal for Johne's and the test result comes back negative, you can't trust that that animal really doesn't have Johne's. It could still have Johne's, but it's just not showing enough signs or not having enough bacteria to test positive on the test yet. But if you test an animal and it's positive, then you do know that you have Johne's in your flock, and that alone can be very valuable information and sort of trigger other actions and activities that you can take to prevent it. Okay, there is some tests of fecal culture where you're trying to grow MAP from a poop sample, but it only gives the right answer about 40% of the time. And fecal PCR, which is trying to find tiny pieces of the bacteria DNA in a poop sample, only gives the right answer about 50% of the time. So postmortem is still the very best way to diagnose an individual animal. You really need to cut it open and see the changes in the intestines. So, you get a positive result, say on the blood test, and you know that you've got Johne's in your flock. Is there a treatment? No, no treatment. So prevention is key, and you want to prevent the disease from spreading. So you can do this by decreasing your stocking density, having fewer animals in a certain space. Make sure that your feed and water sources are clean and haven't been contaminated with feces. Cull animals that are related to positive sheep, such as their lambs. Some people think that the cheapest way is to cull anything that's not doing right and is more than 2 years. So this saves you the cost of the testing, but remember that then you're still testing animals, or you're still culling animals at a very young age when you normally wouldn't. So it's important to understand what is causing you to have to cull these animals. And finally, do your homework. Just like OPP, it's important to ask producers when you're buying sheep what their disease status is and if they do testing for Johnes. Before we go into the production impacts, I want to show you another video. This one's a bit longer. It was put out by the Saskatchewan Sheep Board, but I think it's a really good overview of what Johnes disease is and how you can manage it in your flock. So it never hurts to hear things twice. So here we go.
Hi, my name's Mike. I manage a flock of about 200 breeding ewes. I've been a producer for over 10 years now, and my ewes have always raised their lambs well. But I've recently noticed a few things that concern me. Some of my best ewes lose condition, even though they're eating well. It usually starts after lambing. They just fade away on me. It's a mystery to me. Even deworming doesn't save them. After talking to my vet, I realized that this could be Johnes disease. Apparently, Johnes is caused by millions of microscopic bacteria found in the manure of infected animals. They're called MAP, and they're extremely hard to get rid of. They're even protected from medicine and the sheep's immune system. I've heard Johnes called an iceberg disease. Can't say that made much sense to me at first. My vet said Johnes takes years to develop to where the sheep show signs, and the number of sick animals you see is just the tip of the iceberg. In fact, I learned that less than 5% of infected sheep show sickness at any time. The rest are infected, but you can't tell. So one sick sheep means I might have another 15 to 25 infected sheep in the flock. What worries me most is, while these infected sheep look healthy, they could be spreading MAP all over my farm. My vet calls this secret spread the subclinical phase. He says sheep can be in this stage for years. It's like I'm working in the dark. Just because the symptoms aren't there doesn't mean the infection isn't present. So how did my flock wind up getting Johnes? For Johnes, the first weeks of a lamb's life are most important. My vet told me that most lambs get infected with MAP by eating or drinking it. They have a manure meal, as my son likes to say. Gross. When I think back to how my flock could have come into contact with MAP, I think of some replacement ewe lambs and a young ram I bought at a sale years ago. They looked healthy. I didn't think about asking about the farm they were from or what diseases they might have. Once home, it wasn't long before my new replacements were pregnant. They looked great. At lambing time, I moved them into my lambing pen with the rest of my pregnant ewes. I had no idea they were infected with MAP, but they were. And even though I always try to keep things clean, those ewes were spreading MAP all over the pen through their manure, exposing any lambs born in that pen. Lambs can be exposed to MAP in lots of different ways. Newborns sucking on dirty wool, nursing teats contaminated by dirty bedding, eating hay, or even drinking water contaminated with manure. And on top of that, the lambs born from my infected replacements could have consumed MAP shed into the colostrum and milk. And remember that ram I bought? Well, he spread MAP all through the pasture. Apparently, MAP can survive outside on pasture for more than 1 year. Over time, my replacements lost condition and died. The first one when it was only 3 years old. But you know, I never had the vet open them up to find out why they died. I only decided to test for Johnes when I started to have more animals lose weight. When we found out Johnes was the culprit, my vet explained ways to manage to prevent MAP from spreading more. It's all about prevention and control, especially during that period when lambs are most susceptible. I've made changes to keep the bedding pack and lambing environment clean. I'm adding lots of fresh, clean bedding and keeping things as dry as possible. I clip long wool from the udder area prior to lambing, which helps prevent those dirty wool tags from being accidentally nursed. For the fields, I make sure that all the manure is composted well before being spread, and I make a point to spread it on crops rather than hay fields or pasture. I also keep the dry lot that I use for the sheep clear of manure by routine scraping, and the manure pile is definitely off limits to the sheep. I also focus on culling ewes that show early signs of Johne's and sending them for slaughter only. And I'm not keeping their lambs as replacements. They're for market only. This way, I help break the Johne cycle and not gift other producers with this disease. The goal is to help build up a low-risk flock, and that starts by removing infected animals as soon as possible, keeping the environment clean, and routinely monitoring to identify new infections. I've started being more careful about where I purchase breeding animals too. I'm quick to follow up with my veterinarian if ewes unexpectedly lose condition, and I test my flock for Johne's regularly. But you know, tests don't always come back with the right answer. So I know the only way to be sure is having my vet do an on-farm post-mortem of any animals that die of an unknown reason. My vet said this is crucial for a good flock health program. I also think it's important to keep equipment used to handle sick animals separate from equipment used to handle my healthy animals. It's just good practice. And my family and I handle our sick animals last, so we can't transfer something from our sick sheep over to our healthy ones. I now know that lambs mainly get infected with Johne's when they have a manure meal with MAP in it. So making sure young stock don't come into contact with manure is key, not just for Johne's, but for many sheep diseases. This is what I did on my farm. For you, I'd say talk to your vet and work on ways to deal with Johne's on your farm. You'll see shutting the door on MAP and Johne's all starts with reducing the risk of introduction and managing the spread through good lambing area cleanliness and management. And once you understand how it works, it's pretty straightforward.
Okay, so I hope you liked that video. I thought it was really well done. And I really liked at the end too how they talked about the importance of making sure that if you suspect Johne's, you cull it to slaughter and you don't sell it as breeding stock to another producer, which of course will just cause the disease to continue to be spread throughout Manitoba. So is Johne's disease really a big deal? So in Saskatchewan, they did that study in 2017 that we already talked about that looked at OPP, and they also tested for Johne's. 2.2% of the sheep tested were positive, and 43% of the flocks had at least one positive animal. Of the 43 flocks that had a positive, 9% had two or more positive. So remember that because it can last in the environment for a really long time, having even one animal shedding in your lambing barn and on your pasture can have a really significant impact a few years down the line. So, like I just said, is it a big deal if only one or two of your sheep are positive? Yes, because it can take years for infected animals to show signs of disease. Animals that are positive can shed the bacteria in their feces for years, contaminating the environment and increasing spread within the flock. MAP is also able to survive in harsh environments, including Manitoba. Okay, but my neighbor, cousin, family member, vet, you fill in the blank, told me that there is no good test for Johne's and then I'd be wasting my time and money. So we talked about this a bit before, but I think it bears repeating. Unfortunately, it is true that many tests for Johne's do have low sensitivity, meaning that there can be many false negative test results. So that even if the test result is negative, the animal actually does have the disease and is spreading the disease on your farm. This is particularly true in subclinical animals that have the disease but are not yet showing obvious signs. They're the ones that are under the iceberg, under the water. They can shed bacteria for up to 9 months or more before having a correctly positive test result. So the test, though, is good in that there are a few false positive results, meaning that if an animal's test result is positive, you can be pretty sure that Johne's is present on your farm. This is helpful in identifying if the disease is present in your flock, and if once you know that the disease is on your flock or on your farm, you can take specific actions to limit its spread and impact on your flock, such as culling all positive animals and their offspring for non-breeding use. This is also important more broadly for Manitoba's sheep industry, as eradicating these production-limiting diseases will benefit the industry overall. Okay, so again, does Johne's disease have an impact on your actual bottom line or profitability? And the answer is yes. So the Morris-Hickey study was done in 2006 in New Zealand, and they covered well over 2,000 ewes. I can't remember the exact numbers, sorry, but so the data is in Australian dollars, and it's on Australian sheep and New Zealand sheep, but it's still relevant here. So the first thing that they found was decreased conception rate. That ewes with Johne's disease gave birth to 0.15 fewer lambs per litter. So the litter size was about 13% smaller than the litter sizes of ewes without Johne's disease. The decrease in lamb weaning weight, they found that there is a 3.6 kilogram or 15% decrease in litter weaning weights from ewes that were infected with Johne's. Over the 8-year study period, the total weight of lambs weaned by ewes with Johne's was 30.9 kilograms, or 46% lower than the weights of lambs weaned by ewes without Johne's. So you can see that this is one of those diseases that has an impact over time, not just always immediately. They also found that an overall decrease in productivity occurred. So a 46% decrease in total lifetime productivity for the ewes. 2/3 of the total financial loss due to sheep death was due to a Johne's disease in this Australian study. And the average decrease in annual farm income due to Johne's was calculated to be almost $14,000 per farm, which is a significant amount of money. Johne's also causes early culling and decreased body condition. So the average age of death among sheep with Johne's was 3.41 years old versus 5.03 years for sheep without Johne's disease. And in their last year of production, sheep with Johne's disease weighed 5.3 kilograms or 10.5% less than healthy sheep. Okay, so now we're going to move on and talk about Scrapie. Scrapie is another disease that is fatal and untreatable and has a long incubation period. Scrapie affects the central nervous system, which again is the brain and spinal cord. And this causes weird behavior. So an exaggerated response to a stimuli, or the sheep might isolate itself, or the rest of the flock might actively reject that animal. Okay, so the animal can look normal, but if you suddenly clap your hands or make a loud noise, they can have a weird response to that, where they get startled, they act apprehensive, and they show other signs. So once the disease is developing more, the animals will often rub on fences or buildings as if they're itchy. And if it's severe enough, this can cause a significant wool loss. If you rub the tail head of an animal with Scrapie, you'll notice that the lips start to tremble. They might start grinding their teeth, and their tongue might start darting around in different directions. We're going to watch a short video later that kind of shows these signs that I think sort of really helps you to visualize it. The other classic sign of Scrapie is a weird gait. So this can manifest in different ways depending on the animal, but you might have high stepping front legs where their front limbs are moving in really exaggerated ways, or their hind limbs might be doing what's called bunny hopping. They sort of tuck the back feet under them and it sort of looks like they're hopping a bit. They might be swaying in the rear end. They might stumble, fall, and they might bite at their feet and limbs. That's another sign. So again, sorry, there's a little typo here. They can appear normal until there's a stimulus that sort of triggers a response. Okay, so Scrapie is classified as a transmissible spongiform encephalopathy. TSE, and this is similar to bovine spongiform encephalopathy, BSC in cattle or mad cow disease, and also chronic wasting disease in deer. So when you hear about those diseases, this is similar but different, specific for sheep and goats. So Scrapie has a long incubation period, at least 1.5 years and up to 8 years from the time of infection. Some infected animals will never show clinical signs, or the clinical signs can be so subtle that it's very easy to miss. Once the signs appear, the sheep can still live for 1 to 6 months and continue spreading the agent. We don't really understand exactly how Scrapie is spread, but we understand that it's spread at lambing time through placental tissues and fluids from infected ewes into their lambs and to other sheep and goats exposed to that birthing environment. There's no cure, vaccine, or reliable live animal test. So again, if you suspect Scrapie, it's important to talk to your vet and get it confirmed if you think that's what it is. Also remember, as we've been discussing, Scrapie can look like a lot of other different diseases. Anytime you see a neurological disease, you should think of rabies. We have a lot of rabies in Manitoba in the skunk populations. So if a skunk got into your flock and bit an animal and they developed rabies, it's important to remember that is a zoonotic disease that is fatal in humans. So just consider that and practice safe management. Talk to your vet. It can also look like OPP, listeriosis. Could be mites or lice that are causing the itchiness, pregnancy toxemia, or some sort of toxin that's on the pasture or otherwise exposed to the animals. Okay, so genotyping is a good way that it's something you can do to help improve your flock's resistance to Scrapie. So identify and select your breeding stock that are resistant to Scrapie, and then they pass that resistance on to their offspring. So the test identifies an individual animal's genotype and thus their genetic resistance to Scrapie. So how easily the sheep that is exposed to Scrapie will actually become infected. Once the genotypes of the ram and the ewe are known, you can calculate the probability that they will pass on their genetics to their offspring. And you can do the genotyping on blood or DNA samples. Remember that Scrapie can occur in any breed or crossbreed. In the US, it seems to have been more in Suffolk sheep, but any animal can be infected. Okay, and remember that if Scrapie is found in your flock, it's a reportable disease, and there will be support for you in deciding how best to manage the rest of your flock. Before we move on, I'm going to quickly show you another video. Not the whole video, but the link is there so you can watch the whole video at your leisure. But this just shows some of the clinical signs. So here we go.
An affected animal may appear apprehensive or excitable, particularly after increased activity or after hearing sudden noises. The animal may isolate itself from the rest of the flock, or the flock may actively reject it. In the intermediate stages of the disease, sheep may scrape or rub against fixed objects due to an itching sensation. The scraping or rubbing may be subtle and go undetected, or may be severe enough for the animal to rub off a substantial amount of wool. With stimulation of the lumbosacral area, the animal may experience rapid lip tremors, vigorous chewing, darting tongue movements, and grinding teeth. It may also lose weight and become emaciated, despite no noticeable loss of appetite. In the advanced stages of Scrapie, animals experience progressive incoordination and in severe cases may not be able to stand. Changes in the manner of walking include high stepping of the forelegs, bunny hop movement of the rear legs, swaying of the rear end, and stumbling or falling. Other clinical signs include biting of the feet and limbs and tremors of the head and neck. Affected animals may appear normal if left undisturbed, but sudden noises and movements may cause the animal to tremble, suffer convulsions, or stumble and fall while attempting to run.
Okay, so sorry that the video quality there is not the best, but I think it's really interesting to see those signs and kind of get it in your head. You'll notice in the one scene where he's scratching the tail head and then it's causing tremors, he's wearing gloves. So anytime you see any sort of neurological disease and you want to handle the sheep more closely, please remember to wear gloves. That's the #1 way to prevent rabies from infecting you. So important to remember. Okay, so we'll move on now. So through these 3 diseases that we've looked at, we've been able to appreciate some of the common themes in sheep production. Diseases can have vague clinical signs, and they're often seen at times of stress, such as lambing. Diseases that have long incubation periods give time for the animal to shed the bugs into the environment and contaminate the flock and environment, even if the animal continues to look normal. And generally, these diseases cause a loss of body condition while the animal is still maintaining their appetite. So it's also important to remember that a lot of these signs can be very subtle and cause very subtle changes to your production status. So fewer lambs, not getting pregnant as quickly, lighter lambs, increased lamb mortality, and increased culling of your ewes are all sort of subtle impacts that over time and across a whole flock can add up to big dollars. So what can you do to prevent these diseases? For the most important thing is to avoid bringing it on your farm in the first place. When you're purchasing replacement animals, ask to see health records or talk to their vet, or have your vet talk to their vet. Visit the flock and use your eyes. Look to see what sort of biosecurity protocols the farm is doing. In the video on Johne's, we saw that farmer was handling manure in a safe way where he kept it clean, kept the environment clean, and composted the manure and spread it on cropland. So just check and walk around and see if what the farmer is telling you matches what you're seeing on the farm. Remember to wear clean boots and avoid bringing anything back to your farm, of course, as well. Any animal in your flock that is ADR, or ain't doing right, should be under scrutiny. Write it down. Look to see if there's others that are showing signs. Get your hands on the animal and feel for the body condition. Keep records of any treatments you've done, when the signs started, what their production is like. So for example, number of lambs born, number of lambs weaned, and how that compares to other years. Use diagnostics smartly and know what you're dealing with on your farm. So for all of these diseases, if you know that you've got it on your farm, then you can be proactive to manage and work towards elimination. If you don't know what's going on, you'll continue to lose animals, but not really be able to address the problem in a way that's meaningful. So what can you do? Keep records. Production records are very important. When an animal is sick, record the details. How old is the animal? What kind of signs is she showing? Does she have a temperature? Take a quick rectal temperature and write that down. Did you give a treatment, and what were the results of that treatment? So without this kind of data, we can't look for patterns effectively. But when we have these types of data across a flock, we can start to look and see, okay, these signs tend to happen at this time of an animal's life. They do or don't have temperatures, they do or don't respond to treatment, and we can get a lot of information from those records. Is it an abortion, and do you have an abortion plan? For example, you could freeze the fetus in the placenta, and then if more than 3 abortions happen, then you can consider diagnostic testing. It helps to be cost effective, and you're not going to test too soon. It could just be a one-off abortion, but you also want to catch something if it's something infectious. Sudden death and the power of looking inside a dead animal. So consider doing a postmortem on the farm. Should you call your vet, or is this a one-off? So this takes training to understand what sort of things are one-off versus what are signs of disease. And it's really valuable to look inside and kind of see that. So at lambing time, understand where your losses are occurring and why. So track mortality to understand your farm's opportunities to improve. So for example, is your mortality highest in the first 3 days of life or in the first 30 days? Do you have a decrease in the number of lambs born per litter? That sort of information can help you pinpoint what sort of problems potentially need to be addressed. And tracking progress gives you confidence in what you're doing. So you know if your lambing mortality rates are going down, that you're doing something right. And so that's also important. Getting back to your veterinary client-patient relationship, you need to work with your veterinarian to develop your herd health plan, or your flock health plan, sorry. So you're gonna have, I think a lot of sheep producers haven't had as close of a relationship with their vets as, say, a beef producer, simply because the economics of sheep production means that it's not always economical to have a vet drive out for a single lambing or C-section. But spending the time to have a conversation with your vet is highly valuable, because you can develop certain protocols and plans of what you're going to do to keep your flock as healthy as possible. So together you can develop your biosecurity protocols, like how do you get your replacements and what precautions do you take? What is your vaccine protocol? We need to reduce our antimicrobial use, so this means using as many vaccines as effectively as possible. What is your deworming strategy, and how do you make sure that it's continuing to work? You should also have treatment protocols and withdrawal times. So some of your basic disease problems that you might see, you should have a way of treating them right away and understand how to do that safely and effectively. How are you going to euthanize animals that need to be put down? It's important to understand what your euthanasia plan is. What will you do with the dead stock? How will you dispose of it? And you want to ensure that you've got quality breeding stock. If you're selling breeding stock to other producers, you want to be able to give confidence in the quality of your flock's health status. I think really most ethical sheep producers now are making sure that they're not selling animals that have yonis or OPP, because we really want to avoid spreading that problem around. Another important thing to work with your veterinarian on is ensuring food safety and animal welfare. So for example, if you have farm gate lamb sales, or you go to farmers markets with your products, help your customers feel more confident in your product by making sure that you're handling antimicrobials and disease risk in a responsible way. Okay, thank you very much for watching and listening today, and good luck and have fun developing your own flock health plan. If you have any questions, please contact Ray Whitmore at the number 204-861-2298, and he will get you in touch with someone who can help. And just for your information, these are some of the references I used for this presentation if you're interested in reading further. Okay, thank you very much.